worldwide. So in Malaysia, actually, I searched the latest data, actually is 3.6 million. And Malaysia is the highest incidence rate of diabetes in Southeast Asia. Okay. And it is very common, okay, among Indians. The most common one is Indians, second is Malay, and third is Chinese. All right, and these diabetes prevalence have been rising more rapidly in low and middle income countries than in high income countries. And it's also a major cause of blindness, kidney failure, and heart attack, and also the limb amputation. So the medical expenses is actually very high in Malaysia to treat the diabetes. Okay, and let us see what are the types of diabetes mellitus. Okay, normally we mention the type 2 diabetes, right? Because type 2 diabetes is most common among the types of diabetes mellitus. So how about type 1? So type 1 actually, they occurs most frequently in children and adults. Normally you see the kids, they actually bring the injection of insulin because they know they when to inject. And due to the genetic causes, the body produces very little or no insulin at all. So actually they are very pity because they don't have the insulin to lower down the blood sugar. So how about the type 2 diabetes? Type 2 diabetes normally caused by the lifestyle. The body does not make good use of the insulin. And it is very common in adults, and also is the most common of type of diabetes. Okay. So the third one is happens during pregnancy. We call gestational diabetes. Okay, it is associated with not only will affect the mother, actually they will affect the children also. So it is very risky for both parties. And what are the causes of diabetes? For type 1, actually the exact cause is unknown. Okay, and because of their body immune system is overreact, the immune system will attack their own cells and destroy the insulin producing cell. So you can see this is the insulin producing cells called beta cells. So it will keep immune system will keep destroying the beta cells, so the pancreas could not produce insulin. So the insulin, the more glucose will stay in the blood, they will not go into the cell. Okay, because we know that insulin actually is a very important key to enter our cells. Okay. All right. And the specially also expected the causes are genetic. That's why the immune system will be overreacted, and due to some environmental factors like radiation. Okay. So for the cause for type 2 diabetes, because normally type 2 diabetes, that happens commonly in the individuals with overweight and obese problem. So they have extra fat cells. So this kind of fat cells actually will make the insulin harder to produce, or not sensitive to produce the insulin. Okay, so the cells become resistant to the action of insulin, and the pancreas is unable to make enough insulin to overcome the resistance. You can see this green color little thingy is the insulin. So insulin is like a key, as I said just now, it's like a key to enter our cells, because our cells got the receptor. The receptor is the lock. Okay, and the pancreas is the key to help us to unlock the cell receptor to enter into our cells. So in this case, type 2 diabetes patients, they cannot produce enough of insulin. That's why the extra glucose will stay in the blood. Okay. So for gestational diabetes, during the pregnancy period, the placenta actually will produce the hormones, the beneficial hormones to sustain the pregnancy. But this hormone actually could make the cells resistant to insulin. That's why it's very common that the pregnant women, they are more prone to getting diabetes. Okay, so what are the symptoms of diabetes? You will feel that you want to go to toilet frequently uh, because the high blood sugar level, and also you will feel thirsty and increased hunger. So you eat more, but you experience weight loss. So it is a very unusual thing. You eat more, but you lose more weight, and you will feel more tired, lack of interest and concentration, numbness in the hand or feet, cannot see clearly, frequent infection, and also slow healing wounds. Okay. So if you have some of the symptoms or all symptoms, will suggest you to go to see the doctor and get the sugar checking. Okay, so now comes to risk factors of diabetes. Some people, they are very more risky to get a higher chance to get the diabetes. So for type 1 diabetes, normally they are due to family history. Okay, if the siblings or parents or grandparents have diabetes, so they are more prone to getting type 1 diabetes. For type 2 diabetes, you see, it's more common because you see many factors are related. So family history, the first one, age. If you are older that you get, then you are more chance to get diabetes. Weight. Okay, so as I said just now, if you are overweight or obese, the chance of getting diabetes is higher. And for race also, black people normally they will have a higher chance of getting diabetes because uh, their genetic factor. And for the lifestyle, if you are inactive, you also having get higher chances to get diabetes. High blood pressure and also abnormal cholesterol and triglyceride levels. For gestational diabetes, normally they are due to family history, age, weight, and also race. Okay, so now comes to complication of diabetes. There are many complications of diabetes, okay? So for the first one is the nerve damage. We call neuropathy. You can see the image here. Normally the nerve should getting nourished by blood vessels, the tiny blood vessels, okay? But in diabetes, because the high blood sugar level will cause the blood wall, the blood vessel, wall of the blood vessel will become weakened. So it will reduce the blood flow. And because the nerve cannot get the nutrients and oxygens from the blood, that's why the blood vessels will become lost. And slowly the nerves also slowly disappear. That's why for diabetic individuals, they will feel numbness, tingling in the tips of the toes or tips of the finger. This is because the high blood sugar level causing the blood vessels and nerve to disappear. Okay, and because the high blood sugar level can cause injury to the blood vessel, the wall of the blood vessel, so it will cause many damage to the organs that have many tiny blood vessels. For example, like kidney damage. In kidney damage, right, nephropathy, the protein will leak out in the urine. Okay, and also like eyeball, because eyeball also have many tiny blood vessels, it will cause the damage too, and you will realize that your eyeball will have the curtain wool spots, so you will see, you will have a blurred vision. All right, and also cardiovascular disease, foot damage. So for people who have diabetes, they always have to wear the socks, because if they have cut on the foot, they will have a slow healing wound. Skin condition, hearing impairment, Alzheimer's disease, they will frequently forgetting many things, depression, and also sexual dysfunction. So sexual dysfunction is one of the most common side effects, not side effects, it's the consequences of getting diabetes. So I'll elaborate more on this. Okay, so in men, it will cause erectile dysfunction. All right, it is the inability to maintain the erection firm enough for sex. All right, because because the damaging of nerve and also blood vessels, because by the poor control of the blood sugar, it will cause damage to nerve and also blood vessels. And in diabetes men, they also have lower testosterone. That's why they have low sex drive. Okay, meaning they are harder to get arousal. Okay. And for women, it also have sexual dysfunction, not only in men. In women with type 2 diabetes, I found a report that they are having complaint in getting lubrication, decreased sexual desire, and problems with arousal, also have problems in orgasm, and also in total sexual satisfaction. So due to the poor control of blood sugar control, they were having this kind of condition. So how to do it later, I will review how our products can help. So the treatment of diabetes, normally they will go for medications like metformin, or for those who are more severe diabetes, they will get insulin injection. Okay, and also you must be more active, because if you're more active, right, the insulin actually, the secretion will be more sensitive. And by eating a series of healthy foods also help you to get in shape and also having a good control of the sugar. So how to eat? So this is a recommended diet for individuals. For example, this healthy plate is the meal that you are having. So half of the plate should fill with wet fruits and vegetable, and another quarter should fill with carbohydrates. But please stay in mind that this carbohydrates is not simple carbohydrates. It is complex carbohydrates like brown rice, whole grains, pasta. So this kind of whole grains, okay? It's not simple carbohydrate like white rice and white bread, okay? And another quarter of the plate should consist of the protein like meat, beans, milk, okay? All sorts of this food, all right? So the first thing you have to take note is you have to limit your carbohydrate intakes, and also you choose whole grains, okay? Because carbohydrate is the most direct the food that affecting your blood sugar. The second, you must eat high dietary fiber, okay? About 20 to 30 grams per day. So how to achieve that? Every day you have to eat at least 3 servings of vegetables and at least 2 servings of fruit. So do you eat that? Let me know if you are eating at least 3 servings of vegetable and at least 2 servings of fruits every day. Okay, you can put an emoji like for me to notice whether you are doing that. Okay, and also limiting sodium intake. So normally we suggest them to take less than 1 teaspoon a day for the sodium, 1 teaspoon of the salt per day, okay? And also avoid foods with added sugar like canned drinks and soft drink and fruit juice. And then use 0-calorie sweetener instead. This you can find in the pharmacy stores. And also for those who are having obese, you can take an energy reduction diet like minus 500 kcal per day. Okay. So other than diet, if you feel like you're very hard to control your diet, it's okay. You can slowly, step by step. And at the same time, you can take our main product, our star product from Thanks Eye. It is called Profil. So what is the function of Profil and how does it help to control our blood sugar? So this is how. So proteoglycan actually will bind to fat and glucose and it helps to block from being absorbed in the small intestine. And so it helps to control the blood weight increase and also decrease liver fat. Proteoglycan is also preventing diabetes by its anti-inflammatory action and also controlling the oxygen generation. So you can see the image, the glucose and fats are being, when you eat proteoglycan, right, it will bind to glucose and fats. That's why it will block from being absorbed into the cells. And I also found another study that the changes of proteoglycan actually will responsible for diabetic complication. So administered proteoglycan may reduce or delay diabetic complications. So this is the summary. So function of proteoglycan, if you can see this image, a high level of glucose actually will make the blood become more sticky, okay, and more sticky, and it will cause it will go to scratch because you, for example, you can imagine, right, if the liquid is filled with the sugar syrup, it will become very sticky and will go to stick the blood vessel wall, okay, will go to lick the surface and become, the blood vessel will become weakened and damaged. So a reduce in proteoglycan actually is related to high blood sugar level and reduce complication. So by decreasing damage to kidney and blood vessel, it can help to reduce complication of diabetes. And in people with type 2 diabetes, proteoglycan composition changes also will affect the binding of very low LDL particles that lead to dyslipidemia. Okay. So not only reducing complication, it also helps to reduce the risk of dyslipidemia. That is one of the factors that causing diabetes. Another studies also showed proteoglycan actually can be used to incorporate into a useful therapy for wound healing, because we know that proteoglycan, diabetes patients always worry about their skin will not be healing. So this is good for those who are having diabetes. So how does proteoglycan help in importance? It actually helps to ease the pain, okay? When you're having intercourse, right? This proteoglycan actually helps to ease the pain because it is anti-inflammation, and it also induces a greater healing process and allows cells to communicate better and also regulate the whole hormone balance and production. Okay, so back to the thanks eye proteoglycan. Actually, the extraction technology is very costly and also very difficult. The price for 1 gram is more than 33 million yen. Convert to USD is about 330,000 of USD. Okay, so Mr. Yoshaku Kudo actually successfully researched the world's only LPT alkaline extraction method to extract the high purity natural proteoglycan. So in Japan, right, this Mr. Yoshiaki Kudo has successfully to mass produce it. So actually price for 1 gram 33 million yen. If I convert to USD, now price for NFR members now is 100 USD per set. So if I calculate based on 33 million yen is one set, instead of one set 99,000 USD dollars, you're only getting 100 USD. So it is a much cheaper now. Thanks to Mr. Yoshiaki Kudo, everyone can afford it. And before Yoshiaki Kudo found this technology, actually other company, they're using acetic acid to extract it. So the core protein actually is being cut off and the extraction time is very long. It's about 3 days. Low purity, about 20%. Cost for 1 gram is 300,000. So in Japan, Mr. Kudo actually using this LPT extraction technology, it can extract the complete structure and is combined with hyaluronic acid. That's why the moisture retention is higher. Extraction time is low, it's very fast, 1.5 hours. High purity, about 90%. And cost for 1 gram is only 1,000 yen. And it also acquired the patents from worldwide like Russia, Japan, USA, Europe, and India. And on my left is Mr. Yoshaki Kudo. He received a Prime Minister Award 8 years ago. This is like a Nobel Prize in Japan, okay? So it is not easy to get this product because we know that there are many high quality products in Japan. And this technology has studied by 5 universities in Japan. And his company is very new, within less than 10 years. And it's the first company within Hokkaido in biotechnology industry to get the award. And the second product they would like to introduce is the Perfect Mineral Eye. We have the liquid form and also the powder form. And the folic acid actually also helps in diabetes and chronic inflammatory disease. This is the summary of the study that I found. So the people with type 2 diabetes, actually they will show the signs of chronic inflammation and also increase the pro-inflammatory cytokines, all right? And the folic acid has found to reduce this kind of cytokines and also pro-inflammatory markers. And the study also found that it might fit as a treatment to reduce the markers of oxidative stress. So this study actually showing that folic acid is a good treatment for diabetes and also inflammation. So how does folic acid helps in sex health? So it helps to improve fertility because it can help to balance up the hormonal changes and improve the sexual performance, increase the sperm count, and also increase sexual performance by improving your energy level and also increasing the sex drive. Okay. And also we have the plant minerals in Perfect Mineral Eye to provide the enough of nutritional needs for minerals daily, because we know that, for example, like zinc is very good for men, okay, for increasing the testosterone, enhance oxygen level in body, and also increase the blood flow. And in total body, it can help to improve the metabolic function and reaction. Okay, so I have mentioned about folic acid, but what is folic acid? It actually is a transporter for minerals. So folic acid actually is a very tiny molecules, and the folic acid and minerals actually they are bind together due to the electrical charges. They are bind together. So folic acid is a bigger molecule that combine the tiny molecules of minerals to deliver them to the parts that are being needed to the cells. And minerals are indispensable to our life activities. As you can see, I put red color in the font is red color, like vitamins and enzymes. It's actually an essential nutrient for vitamins and enzymes to being absorbed in our body. So mineral is very important in forming the organs like blood, bone, cell formation, to balance the hormone, and also helps to detox. Okay, so minerals are also a powerful natural antioxidants. So what is antioxidant? Is actually an elements to help to fight off aging, anti-aging. Okay, so every day our body actually receive damage from UV rays, from pollution, air pollution, stress also, and also poor diet. So this kind of damage actually will cause the free radicals to enter into our cells. So if our cells are not strong enough, that is not protected by antioxidant, it can cause damage to DNA very easily. That's why the cells are mutated. That's why we are getting more chronic disease like diabetes and also cancer. So this is how, put in a simple image to explain free radical and antioxidant. So on the left side, the green color is a stable molecule. So it has a very even electrons, but for free radicals is our enemy. Why? Because they are an unstable molecule, because they have unpaired electrons. So they will go to steal the electrons from the stable molecule. And the antioxidant actually, they have extra electrons, so they can donate to the free radicals to make them stable. So antioxidant is the good friend of our cells. And this is Dr. Linus Pauling, who won the Nobel Prize twice. He said that all diseases are due to insufficient of minerals. And insufficient minerals is the main cause of disease nowadays. And there are reports from Japan also stated that through the supplement of minerals, it can treat the new nutritional disorders. So you will say that, oh, not enough of minerals, you just eat some foods to replenish it. But actually our content, food content of minerals is very low. Okay, in the past 100 years, 80 to 90% of minerals in our land have been lost. So our food, actually the nutrients are come from soil. So if you have poor soil, we have poor food also. Due to the world population is getting higher and the pollution, the soil pollution, and also using chemical fertilizers, so our soil quality actually is getting worse. Okay, so this slide explains that most minerals cannot carry out function, even just one of them is sufficient. So meaning that for minerals, they are not only working by themselves. Actually, they are working by a team. Okay, so for example, like transportation of iron, they will need different minerals to do it, not only one, depend on single minerals. And our body actually need 90 types of nutrients, and 60 to 70 types of nutrients actually are from minerals. So what's so unique about our Thanks Eye Perfect Mineral Eye is actually extracted from US, that from ancient plant sediment, is about 100 million years ago. So the minerals are absorbed by the plants in the dinosaur area. So from 100 million years ago, you can see the plants are actually very huge. So the plants actually bury it underground, and the microorganism will help to decompose the plant into the tiny molecules of fluid acid and minerals. Okay, so our Thanks Eye mineral actually is plant-based, it's very safe, and it helps us to replenish minerals and excrete the toxic wastes. And if you compare to the inorganic minerals that's selling outside, actually the absorption rate is very low, about 10 to 40%. Okay, so for plant minerals actually is very high, it's about 100% absorption rate. So it's very important for us to check the absorption rate if we are eating the supplements, or else you will just wasting your money. Okay. So because of the tiny molecules of plant minerals, that is 7,000, 1 per 7,000 of red blood cell. Okay, so it is very tiny. So it can absorb directly into our cell. Okay, so we have talked about the benefits. It has a lot of benefits, but how about the safety? So you're not worried because our products, you can see the product packaging, the left side there's a logo, JAPA logo, okay? So it is awarded with Japanese Association of Preventive Medicine for Adult Disease. So this medical association actually established 30 years ago, about 30 to 40 years ago, and it is made up of 6,600 doctors, and they have to go through a lot of the careful, strict testing, and if they show the result in improving physical health and also prevent the disease, it only can be awarded with the approval. Okay, so that's why you can see our products are certified. There has a logo on the packaging. And in these 30 to 40 years, only 52 companies are getting awarded. and Thanks I is one of them. If you realize, we have 5 products that getting JAPA award. Okay, so at the last part for testimonial, so we have one testimonial, and this member actually, he is a diabetic, and also he has the wound healing, not wound healing, is have a wound on the arm area, all right? So he actually taking 3 pieces of Profil every day, okay? So it has a speedy recovery within 2 weeks. You can see, right? This is the 3rd day. The second, the first one is like this. You can see the tissue already blackened and also already spoiled. So if he take Profil 3 pieces a day, and you can see after 3 days, the wound actually is dry up. Okay, and after 2 weeks, you can see that the skin actually is recovered. All right, so he also using the spray. He using 1 piece of Profil to mix with the water to spray on the area, so it can see that the moisture retention is there. Okay, because Profil actually helps to retain the moisture, and also I shared the studies they are shared just now. It can help to improve the wound healing. That's why it can help in diabetic cases. So yeah, this is the testimonial for today. Okay. So thank you all for your attention. So do you have any question? If you have any question, you can turn on your mic to us, or you can leave the comment at the chat box area so I can check it out. If there is none, then I will end my session today. Thank you, everyone.
Thank you, Ms. Jen. Yes, we have some questions. So can you please stop sharing the screen?
Okay.
Okay, so we have questions here from India.
All right.
Which one is more effective? I don't know, effective to what? Because only asking about which one is more effective, powder form or liquid form in AI mineral. Which one is better?
Okay. Mineral powder or liquid?
Yes.
Or Profil?
AI mineral. Mineral
AI
AI.
mineral. Okay,
Yes.
so for mineral, I actually both are very beneficial for the diabetes, because both also contains uric acid. So both are actually effective.
Which one is better, liquid or powder form?
They are both actually same effective, because both contains minerals and also uric acid. So if actually both are beneficial for diabetes, but if you are you want the benefits of vitamin C and also vitamin B to boost the energy level, then you will go for the powder form, and it is very easier to for travel, so you will get the powder form.
Okay, thank you. So another questions. Any specific restrictions on specific food habits?
Yeah, for diabetes, right? Like I said just now, you have to limit the simple carbohydrates, and also the foods that with added sugar also need to avoid.
Okay. Is there any questions from female side, Miss Mara?
Yes, I have a two
Please.
question here. So the question one is from Florida. So
All right.
yeah, the question is what is the difference between liquid mineral and the powder ones? What's the
What are
difference?
the difference?
Yeah.
Okay. Okay.
I don't know what kind
As
of.
okay. So both actually contains folic acid and plant minerals, but for powder form, we make it easier to travel, so it is very light, and we also added vitamin C, okay, and also vitamin B, B2 to boost your energy level.
All right. So the question two is by Miss Coco. So does profile or mineral helps cure rheumatism? Cause her friends has it and very suffering right now.
Uh, Curing what kind of disease? Sorry.
Rheumatism.
Rheumatism. What is that?
Oh, I type for you. Or you
Okay.
wanna? Yeah, sure.
It's rheumatism.
Oh, rheumatoid arthritis, right?
Yeah.
Rheumatoid arthritis. Okay, Profil. Profil will help because in rheumatoid arthritis, right? Rheumatoid. Rheumatoid is Joyfil can help. Joyfil and Profil together. Because in rheumatoid arthritis, that the autoimmune disease. Okay, so the Profil actually will help to stable the immune system.
Okay, that's the only question.
Okay,
Yes.
thank you, Ms.
Thank
Mara.
you, Jen.
Thank you.
Can I ask one question?
Yeah, sure.
Okay, I'm from Singapore, Jeffrey Tan. I'm diabetes person. So can I
All right.
use the Profil mineral together with my medicine, or have to fall apart? Let's say after using mineral, then I have to wait for at least 1 hour or something like that.
Oh, no need. There's no time concern about this. You can take it at any time because it is food.
Before empty stomach or after food?
After the food, because minerals are sour. The
Or
pH
after
level is
food?
low. So
After food.
after food together with Profil.
Okay, thank you.
Thank you.
Can I ask a question?
Yeah, sure, please.
Okay. I understand that in your powdered minerals, you have what was it in the milk? Lactose. Is there lactose in the powder? So if also someone who is lactose intolerant, they should avoid the powdered minerals, right?
Yeah, but actually the level is very low. It wouldn't cause any discomfort.
Okay. So yeah. It's very, very little.
Very, very little. Yeah.
So, I found that when I take minerals like 1 sachet per day, it gives me a slight constipation and it makes me bloated. So can I sort of take less for each day? Maybe because my body.
You feel bloated.
Yeah, I feel bloated.
You can try to take constipation.
Also,
you have to drink more water. Yeah, drink more water.
I do drink lots of water, but it gives me constipation. So will be equally effective if I take less per day?
You can try to
1 sachet. I try
to reduce half sachet per day and drink more water and see how it goes.
So what I do, I mix them and keep some in the fridge, right? Mix all the sachet and then have it and then keep some in the fridge. Is that okay? Will it still be fresh? Okay, good. Thank you very much.
Thank you.
Okay, Ms.
I
Jen.
got one more question.
Okay, go ahead.
Okay, for this mineral, is it all right for Muslim to use? Halal, can they use or not?
We haven't get the halal certificate for this product, but this product actually definitely is pork free. The only product that are halal certified is Profil and Joyfil at the moment, but we are in the midst now of getting Perfect Mineral Eye product certificate.
But this mineral, isn't it plant-based?
Yeah, actually it's plant-based.
Then it should be halal. I'm a Muslim, you know. You don't add anything else to it.
That's why I say ingredient-wise is free. Is free of the ingredients, but it just don't have the chop of the logo.
Okay, Ms. Jen, we have questions again. How many Thanks I product have a JAPA certificate? And the second question is, any age restriction and or some medical conditions maybe if we're taking a Profil or mineral AI?
Okay, sorry, what is the first question again? Or how many products are getting JAPA logo, right? Actually, it's 5. I mentioned just now it's 5 products. It is mineral, liquid, mineral powder, mineral capsule, profile, and also canal.
Wow.
Canal.
5 product with Japa. Amazing.
Yep.
Okay. Wow. So out of 65, we have 5 here. 65 product. 65 awarded by Japa. 5 is thanks I. Wow, wonderful. So the second question is any age restrictions or some medical situation restriction if we take Profile or Joyfil or Mineral AI?
Okay, so there is no any age restriction for the products, but for the products that with Perfect Mineral Eye, for those who have kidney problems should take note, because if they have kidney problems or they are undergoing dialysis, actually they cannot take too many minerals. So that's what the medical condition that have to take note. The one with kidney problem. Okay, so did I answer your question?
Yes, thank you. Okay, there's a question from Miss Coco from Singapore in the chat box.
Do we have to get doctor advice before taking Profile or Mineral if we have diabetes or rheumatoid arthritis? Yes, it's always good to refer to your doctor if you are taking Profile or Mineral for the safest conditions. Yes, you can. And don't forget to eat your medicine. Don't always depend on supplement. You must eat your medicine at the same time when you're taking Thanks Eye products. Yeah.
Yes, guys, because it's nutrition. It's the same like food. Let me edit something that can maybe have a reference for asking medical advice from medical person. Just use the reference from the PubMed, because sometimes if we talk to medical person or a doctor by only using testimonial, they don't believe it. So of course we have the beneficial of JAPA certificate and halal, but you can also search in PubMed website. Proteoglycan have almost 50,400 scientific journals, so it's very good. It's a very good reference for medical world. I already do that with some friend of mine that they professional, sometimes a nutrition doctor or researcher. I have some friends in the hospital. They will agree about whatever I tell about this amazing product if I have some reference from the scientific journal. Okay. So any more questions from the participant? Yes, we have one. Okay, there's a question. How long can the mixed mineral, be it powder or liquid from, can be kept? Can it still be drink after 24 hours left at room temperature? Oh.
Okay. For best result, actually you should not left at the room temperature for more than 1 day. You must consume within 1 day for safest condition.
Wow. Okay. Thank you.
Thank you.
I'll answer the questions. Any special occasion from office, Miss Jen, that I asked yesterday?
Special occasion today. You see, the office is very clear today. Don't have any member. That's why you can see it. You can listen. That it's very quiet to my voice. Yeah.
Okay. So there's another question. Is there any product for weight loss. Weight loss.
Yes, there is canal and also profile, because profile can bind to fat and the sugar, and it also prevents being absorbed by your body. And canal is actually a seafood fiber to lower down your cholesterol level and binds to fat as well.
Yeah, canal, the red one, right?
Yeah, the red one.
Yes. Okay, I think that's all. Thank you for joining us today. If there's no any more questions, thank you.
Thank you, Mr. Yosep.
Thank you, Miss Jen,
Thank you.
for having a great
Thank
time with us,
you.
sharing with us the benefits of proteoglycan and minerals AI. And thank you, Malaysia. Thank you, Singapore. Thank you, India. Thank you, Europe. Thank you, South Africa. Thank you, all around the world. Thank you, Indonesia. Thank you. And remember, tomorrow is a very special night. Just start inviting people that you care, need some help. You know, this tough time is very high pressure for our mind, right? So we need to help them to give solutions, both financially and health. So invite them to our TGIF tomorrow night. So I'll see you guys again tomorrow. I'm Joseph, your host. Thank you, and saying goodbye to everybody. Bye.
Thank you. Bye bye.
Thank you.
Thank you. Thank you so much.
Thank you.
Thank you. Thanks a lot. Thank you.